PRP stands for platelet-rich plasma therapy, which is derived from a person's own blood cells. It's inherently enriched with growth factors and pro-inflammatory cytokines that will help to actually achieve a regenerative effect in the joint or tissue where the PRP is being applied. If you were to come in for PRP, what that involves is coming in, having a visit with a licensed and trained naturopathic physician who's board certified in prolotherapy, PRP, and injection therapist. And then we would run you through some orthopedic tests and make sure that it's applicable for your case. And if you are deemed to be a good candidate, then we'll take some blood, centrifuge that blood in a specific way, and then re-inject that blood into, or the plasma rather, the platelet-rich plasma, and inject that into the joint or a specific tissue area that we need to apply the therapy. After a patient has a PRP treatment, in that first treatment, we actually augment the PRP with laser therapy. So the specific wavelength of laser that we use, and we apply this directly into the joint or the specific region where we're applying the PRP, the laser treatment actually helps to improve the recovery time. So with PRP, the objective is to initiate some inflammation. There's good inflammation and there's bad inflammation. The laser actually helps to cut down some of the inflammatory cytokine release that we don't want, and it harnesses the inflammatory cytokine release that we do want. So the good type of inflammation that's actually going to help to achieve that regenerative effect. So our patients actually recover from the PRP very quickly, usually within 2-3 days. They don't feel, they feel like they can return to most of their activities. In the first couple of days, you might notice some soreness, some inflammation, and that's perfectly normal. That's to be expected. That's actually a really good sign. Immediately after the PRP, most people will feel a little bit better depending on the type of condition that they have. So if their condition was associated with a significant lack of mobility, they might notice that even immediately after they feel a little bit more mobile. And if they had a lot of pain associated with that tissue injury, then they actually will often feel like their pain is diminished almost immediately. So our patients will report a reduction in pain, usually within 2-3 days. But the maximum benefit of the PRP is actually achieved at about 6 weeks. So 6 weeks post PRP treatment is when we can really appreciate the full benefit of the therapy.